In 2020, as the COVID-19 pandemic disrupted most of the world, the government of Vietnam successfully managed to contain transmission and kept reported COVID-related deaths at a low level. However, in the middle of 2021, the Delta variant caused an explosion in transmission and deaths. The government's TB workforce was reassigned to assist with contact investigations, COVID-19 vaccination campaigns, or management of severe disease. Hospital wards dedicated to treating TB were converted to quarantine and treat the novel coronavirus. In turn, TB services were negatively impacted, and the number of people with TB detected in the third quarter of 2021 dropped by 60% in major cities compared to the previous year. To buy time to scale up vaccination coverage, Vietnam moved into stricter and stricter social distancing restrictions, and eventually a near total lockdown of major cities. The Erase TB project, implemented by IRDVN, with support from the U.S. Agency for International Development, known as USAID, jumped into action and collaborated with the government of Vietnam and a consortium of local nonprofit partners to maintain TB detection and treatment as a health priority. The project worked in Hanoi and Ho Chi Minh City to develop and pilot an innovative strategy that integrated TB screening into COVID-19 vaccination events. This integrated approach aimed to diagnose people with TB and COVID-19 sooner, resulting in a shorter period of infectiousness and a reduction in disease transmission. After a person received their COVID-19 vaccine, they were asked to wait for 30 minutes to ensure that they did not have an adverse reaction. During this window, Erase TB staff invited participants to take a free chest X-ray using an ultra-portable, battery-powered X-ray machine. Due to the shortage of available radiologists, artificial intelligence software was used to scan the digital chest X-ray in order to detect lung abnormalities related to both TB and COVID-19. If any abnormalities were found in the lung field, participants were provided with a rapid COVID-19 test and asked to produce a sputum sample for expert testing. COVID testing results were provided within minutes, and TB results were delivered over the phone within 3 days of sample submission. All of this was done on-site in the local community. Vietnamese government authorities from the People's Committee and health authorities mobilized the general public to obtain vaccines, select the sites, and coordinate the events, while Erase TB staff managed the TB services. Over the course of 9 months, from late 2021 to early 2022, the Erase TB project X-rayed over 41,000 individuals in 10 districts of Hanoi and Ho Chi Minh City. We detected only 5 people with COVID-19 infection. However, we detected 120 people with TB, including 16 with drug resistance. This TB detection rate was 1.8 times higher than the TB rate in Vietnam's general population. This pilot occurred in cities that had imposed lockdown restrictions, which made all aspects of movement, mobilization, and operations more challenging. Continuing TB care during the COVID-19 pandemic required innovation on 3 fronts. Firstly, it required intense collaboration with the government of Vietnam at the national, provincial, district, and ward levels, and the willingness to engage with new partners, not only those in the public health system. It required new technology that could reduce staffing requirements and bring services to any location where vaccines were being distributed, regardless of the local facilities. Lastly, it required the willingness and organizational agility to organize the TB screening services when vaccine supplies were made available, sometimes with less than 24 hours notice and often over the weekends. The pilot supported by USAID through the Erase TB project has demonstrated how to continue progress towards TB elimination while assisting the local government in reorienting the health system for greater pandemic preparedness and response. Based on the success of the pilot, the Vietnam National Tuberculosis Program recommended applying this model for TB screening at COVID-19 vaccination campaigns nationwide. It serves as a model for other low and middle income countries for making TB prevention and care more person-centered and accessible.